for Chiedza is to provide a holistic child development program. It was formed in 2001 by two people who were interested in working with children, Mrs. Stella Mescano and Mr. Dev Shian. Currently we have 755 children. Out of 755, 9 of them are not orphans, the rest are orphans. We look at a child who has either lost one parent or both parents. That's what we call an orphan.
Ndinonzi Memory Chabala. Ndinogara na gogo wangu, maparents angu ese akafa. Tinobatsirwa pana pachiedza nezvinhu zvakawanda. Tinobatsirwa nechikafu. Tinobatsirwa nemauniforms, nebhadhara school fees, nemamwe maexpenses akawanda. Ndinonyanyoda kuuya pana pachiedza nokuti tinopiwa rudo rwakanyanya. Panopiwa chikafu and pane education, vanoitiswa maextra lessons panapa. Tinodzidziswa Bible.
Ndinodzone Zimbabwe. Ndogara Sarigdo 2. Ndiri mukomana ane 17 years. Ndogara naamai. Chiedza inondibatsira mukundibhadhara school fees, nekutekera uniform, kutengera boots nemabhuku nemapeni, nekuti ipo chikafu chekuti unodyawo kumba.
We provide educational assistance, we provide food, we provide psychosocial support, we also provide
Nodzidzisa panapa ma-O-levels. Ndoticha shona ma-arts, shona history ne-English. Tosanganawo after school, after their formal education makuseni, tosanganawo mana 2 to 4.
Pakuvapa kwatiita ma-extra lessons, ma-resources mashoma. Uye nemasubject andiri kuticha vanenge vachidawo kumboona kuti chii chinonzi experiment havasi kuzviita izvozvo, zvizhinji tungotheoriza. Saka it's quite a big challenge. Chisho changu ndechekuti dai in the near future vaedza kuprovide vana nema-resources ese anodiwa kuti vakwanise kupasa.
Our goal is to help as much children as we can. Of course, the limiting factor is the funding, the sponsorship for our programs. But we would want to sponsor more children than we are currently supporting.
It's impossible to sponsor all 800 of our children, but we source for sponsors who can help a few of our children. As you know, our economy is a problem.
We find sponsors locally in the country and also outside the country, those that are interested in supporting us.
I work for an organization called World Education Incorporated, which is headquartered in Boston, United States. We work in 23 countries. In Zimbabwe, we run what is called the Children First Project, which is a US government-supported project, and it works with supporting orphans and vulnerable children in their communities. With Chiedza, we work with them twofold. We work with them to support the work that they do with the children here through school feeding programs, education support, but we also give them block grants where we ask them to pass on money and support schools in the community so that all the children can benefit.
From Monday to Saturday, we have activities lined up for our children. Mondays, we have study time storytelling. Tuesday, it's music day, drama. Wednesday, sports. Thursday, practicals. Friday, we come for feeding, peer education. Saturday, we do sports and feeding. But every day, we do feeding.
I'm the nutrition officer as well as the documentation officer. What has inspired me to work as a nutritionist is to make sure that we curb the malnutrition within the children here at Chiedza.
The food that you cook, where do you get it?
We've got several donors that actually donate to the center, such as CRAS, Stephen Lewis Foundation. We've got ADRA, Children First. There are various donor organizations that actually donate to us.
Nindiri volunteer. Ndinachibikira vanofana pachiedza. Tichifeed vana newe preschool kwese. Pana patinowanzo bika bauga. nebeans. Dzimwe nguva tinovabikira sadza nematemba. Vana vedu vakati one day vanotosvika kuma 700. Vari kubva mumacommunity. Pana patichengete vana vanobva mudzimba dzavo. Kana vabva kuzvikoro masikati waya pano tovafidha woita ma-extra lessons form 3, form 2, form 4 ne grade 7.
Sometimes we do not have enough supplementary feed to actually give to all our children. Like right now we've got an increase in the number of children. They've increased to 755, and we are trying to actually source food enough to feed each and every child that comes into the center, and this is one of our major issues. And then also the other challenge that we're facing, because most our donor funders have actually cut down on the funding that they used to give us. We're facing challenges of being able to balance everything within the center, from nutrition to administrative work. In fact, I would say we're facing difficulties to balance all the programs that we run here at the center.
We have the nutrition department, we have the health department, I think you saw the clinic, we have the preschool department, we have the resource department, and we also have the admin department.
My name is Dr. Chiedza. I'm a voluntary doctor at Chiedza. I come once in 2 weeks to hold the clinic. We see children especially, and then adults as well. And we also conduct health education for the children that come to Chiedza. We also help the staff if they are ill, and we also help with any health-related conditions or medications that are needed. So our clinic is really run basically after every 2 weeks on appointment, and sometimes only when it's an emergency we can see patients at any time. And we prescribe drugs and we do routine health checks on the children as well as on the staff. My motivation really stems from biblical principles to help the community to do the best I can for people, and that's where I get my motivation.
My name is Daphne Maungi. I'm the preschool supervisor at Chiedza. Usually when you talk about preschool, it is where the welfare of the child is the most important factor. The child is safe. The child is under adult supervision. The child comes into contact with children of his or her own age. That normally doesn't happen to a child who's the only child in the home. So we provide the social side of development in a child. Children do learn through play. We do a lot of activities that enhance teaching in a child, or it instills some values in a child. Even when they're in their dolly house, when they're playing house, that's the social side, that's the social aspect, the concept we develop in a child. They also